You probably know Cone Health for your primary care or perhaps emergency care in the case you need it. But have you thought about using Cone Health for your pharmacy services? Cone Health has a wide range of ways to help you get the medications you need. Ashley, tell us about the Cone Health Community Pharmacy. What is it?
So we have 9 Cone Health Community Pharmacy locations. They operate like any other pharmacy that you'd have in the community. We have prescription services. We have free home delivery throughout North Carolina and Virginia. We offer a whole range of immunizations. We definitely are for the community. We are not employee-only sites, but we fill prescriptions just like any other pharmacy would do.
Then tell us what's happening in this room.
So we're filling a ton of prescriptions every day. And because we're filling them here, that frees up the employees at the community pharmacies to take care of those patients who are directly in front of them.
Okay, so from here, these prescriptions go where? To the pharmacies or to houses?
Yeah, 50% of those go directly out to our community pharmacies, one of our 9 sites. The other 50% get delivered directly to the patient's front door.
So how quickly could a patient actually get from calling in to actually holding the prescription in their hand?
Oftentimes it's within 24 hours. So you may call, let's say noon today, and by noon tomorrow, it's on your doorstep. It is very common.
How are you doing?
Good, how are you?
I'm doing fine. Look, I've got a prescription for medication. It says take me twice a day.
Okay, and so we're in a central location. What is this building we're in right now?
So this is just a packaging facility. So what this does is remove some of the volume out of our community sites so that those folks who are on the site in the stores can actually interact with patients one-on-one rather than having to handle all of the packing and phone call interruptions.
Yes, so also the phone call. That's a really important part because that's happening here too. Tell us about that.
Sure. So we have a community call center and a specialty call center. So all calls that are routed to our community pharmacy sites will actually go through that team. That team is made up of our employees. They do float through our site, so they're very familiar with all of our locations, all of our staff, and all of our procedures. And so that, again, allows the folks who are in the sites to handle patients one-on-one and really give them the time that they deserve.
Kristen, what is a specialty pharmacy?
So specialty pharmacy medications are often high cost or highly monitored medications. Here at Cone Health, we have a robust specialty pharmacy service line. We have specialty pharmacists embedded in our clinics as well as here in our specialty pharmacy call center. And really what we try to do, specialty pharmacy can be very difficult for patients to navigate. Oftentimes patients have trouble understanding what they need to do through their insurance, what needs to happen for their copay if that cost is high. And we are really here from the beginning, from the time that prescription is written and we receive it on our end until the time it's delivered to the patient and even beyond. Our pharmacy services here at Cone Health support the patient if they have issues with side effects, if they need help with adherence. We're really here to offer a service to both our physicians as well as our patients to make sure that specialty pharmacy patients are taken care of throughout the care that they're receiving here at Cone.
Can you give us an example of maybe some conditions that might fall into that specialty pharmacy category?
Yeah, so we have embedded clinicians within our rheumatology space, cardiology, oral oncology, and infectious diseases primarily. That's not everything, but those are some of the disease states that we cover here at Cone.
How do people manage their prescriptions? By calling, by email, app, what?
Any of the above, honestly. We've got a call center here. That call center team is more than happy to help manage that. We've got something we call medication sync. Inevitably, with healthcare, you're going to have one script that falls early in the month, one script that's in the middle of the month, one script that's later in the month, and you hate making 3 trips to the pharmacy. So instead, our team can help MedSync get those lined up so it's just all in one order. So they can take care of that. They can take care of automatic refilling your prescriptions. They can take care of sending it to this location for us to get those home delivered, or they can send it to the pharmacy. It's all up to you.
So this medication can be taken 2 at the same time as long as you have some food on your stomach.
So we've got about 20 folks who are working inside of this room on any given day. About 10 more, 12 more are out in the call center. So these folks here are all pharmacy trained, all certified technicians, the highest level of technicians. We've got a handful of pharmacists as well. This team is working together to make sure that we're filling the prescription safely and then that we're then packing the prescriptions to get them out safely. Our error rate here is about 1/10 of a standard big box retail site, something I'm really proud of. And the reason for that is there are intentional operations decisions that we've made in terms of having extra barcodes that have to be scanned at every step and making sure that all along the way the patient is getting exactly what they asked for, nothing more, nothing less.
Pharmacy is a tough world. It's very, very busy, and we want to do it in a way that really provides an extra level of patient care. Anybody can use our pharmacies. All they have to do is call us, reach out, email us, go online, use my chart, use the website, and request that we transfer your prescriptions, and we'd be happy to do that for any patient.
Do you use the pharmacy yourself?
Absolutely. Yeah. I've got right up the road here is the Med Center High Point. That's the pharmacy that I use. Yep. Yeah.
And what do people tell you about their experience?
They're always surprised when they first start using it at how fast everything gets to them, but also they walk in and they're like, oh, this is like pharmacy used to be, where everybody's smiling and happy and knows your name. A lot of it is that community feel that we all got into pharmacy to do.
If you have any questions, please feel free to call us. As long as it's taken with food and space it at about 8 to 12 hours, you're good to go.
Sounds great.
All right, thank you so much.
Find out more about Cone Health's pharmacy services by visiting one of their 9 community pharmacy locations or just going online, conehealth.com. You'll find the link right there on the homepage to Community Pharmacy.